Hello, I'm Sneha Koshi. Well, hearts are more than emoji confessionals and construction paper creations. They are fist-sized engines that power the human body. Problems with the heart affect the entire body. No wonder then that heart disease is such an important public health issue. Heart disease is the leading cause of death worldwide, claiming an estimated 17.9 million lives each year. Up to 50% of all cardiac deaths due to cardiovascular disease occur in people who have no history or symptoms of heart disease. Cardiac emergencies can occur at any time and at any age. Sudden cardiac arrest and heart attack are such emergencies. Even young adults suffer from sudden cardiac death due to their sedentary and stressful lifestyle. Without immediate recognition and cardiopulmonary resuscitation, the chance of survival decreases significantly with every minute that passes without life-saving measures. It has been proven that bystander CPR improves the rate of survival by almost 50%. It is even more important if you have a loved one who has a history of cardiac disease, as research reports that the majority of cardiac arrests occur at home. CPR knowledge will equip you with the skill and the confidence needed to transform yourself from the role of a bystander to a lifesaver. Save a Life is an initiative through which people will be made aware of the early signs and symptoms of cardiac arrest so that patients can get to the hospital in time and also be trained on giving CPR if the need arises. Today, we have with us eminent cardiologists who can help you understand sudden cardiac death and the role of CPR to revive and save a life. We're being joined by Dr. Anand Kumar D, Consultant Interventional Cardiologist, the Mani Heart Center and Laboratory, Kolar, Karnataka. Dr. Asit Khanna, Principal Consultant and Clinical Coordinator, Interventional Cardiology, Yashoda Super Specialty Hospitals, Ghaziabad. Dr. Tanuj Bhatia, Cath Lab Director and Interventional Cardiologist, SMI Hospital, Dehradun. Well, first question to Dr. Kumar. How common is heart valve disease? What are the types of heart valve diseases? Dr. Anand Kumar D.
Yes, it is not uncommon for the heart valvular disease even today. But earlier, heart valvular diseases were more of infectious in origin. Today, it is due to many other diseases like heart attack and cardiomyopathy and etc. And types of valve diseases are divided depending on whether it's a leaking valve or obstructing valve into regurgitation and stenosis. Regurgitation means leaking of the blood from one chamber to back to the chamber from which it received. Stenosis means blockage of the blood valve flow from one chamber to another chamber. And depending on the reason, if it is from the birth, we divide it into congenital heart defect. If it is after birth, it is called acquired heart disease. For example, mitral valve stenosis, mitral valve regurgitation, aortic valve stenosis, regurgitation, and there can be combined mitral valve stenosis and regurgitation both together.
Is heart valve disease always something you're born with? What are the causes and risk factors of heart valve disease, Dr. Asit Khanna?
The most common causes of valvular heart disease are diabetes, hypertension, cholesterol, and infections of the heart valves, which is more common in the third world countries, especially India, that is rheumatic heart disease. These are the 3 or 4 most common causes of valvular heart disease. I again repeat, hypertension, diabetes, cholesterol, because of which we get heart attacks and heart dilatation and heart failure, which results in heart disease, valvular disease and rheumatic heart disease. The other is when the heart valves become thickened and they get blocked by deposition of cholesterol and calcium, that is called valvular stenosis, and the valves are blocked. But yes, there is a small subset of people who are born with valve diseases. Rarely we have children born with mitral valve diseases like parachute mitral valve and valve stenosis, or aortic valve, which usually has 3 leaflets, but they are born with 2 leaflets or 1 leaflet, which is called bicuspid or unicuspid aortic valve. So to summarize, the congenital valvular heart diseases are much more rarer, but they do exist, and the acquired valvular heart disease, which we get as we go older and older, are much more common. And these kind of cases we see much more frequently, that either the valves get torn, which we call as regurgitation due to diabetes, hypertension, stress and everything, or they get blocked because of the deposition of cholesterol and calcium.
How do you know if you have heart valve disease? Are there any early signs or symptoms? Dr. Bhatia?
So there are a variety, a constellation of symptoms of heart valve disease, of valvular heart disease to be precise. The first and most common is a shortness of breath, something that we technically call as dyspnea. So the patient feels out of breath. This can happen on a very high level of exertion earlier, and then as the disease progresses you can have it at lower levels of exertion and sometimes even at rest, something that we call as orthopnea, in which the patient has dyspnea in lying down position, especially in the night, something known as paroxysmal nocturnal dyspnea. The other symptoms could be chest pain, something like angina, which is more common in aortic valve disease. Then you can have fatigue, that is early tiredness. Another symptom could be lightheadedness, something like dizziness, kind of a fainting episode where the patient might lose his consciousness either completely or might have a tendency of losing the consciousness. Sometimes even abnormal swelling of the feet or some abdominal bloating could be a symptom, and sometimes just a rapid weight gain might be a symptom in which the patient feels that they have gained weight recently because of heart failure. The patient should also be conscious about fever, another symptom could be abnormal fluttering of the heart, that is more technically called as palpitations. So there are a variety of symptoms of valvular heart disease.
What are the treatment options? Can a valve be repaired instead of replaced, Dr. Anand Kumar D?
Depends on the severity of the valve disease, depends on the particular type of the valve involved, depends on the age and effort tolerance patient has. If the patient has mild to moderate valvular leakage or blockage, that can be managed with modest medical treatment tailored to that particular patient with lifestyle modification. And if the valve leakage or blockage is too severe, then the valve needs either repair or replacement. Yes, coming to the question whether replacement is better or repair is better. If the valve is repairable, if the natural valve has good elasticity and good physical fitness for the repair, we always refer those patients to repair because they do not need a drug called oral anticoagulant, which is a very strong blood thinner that can pose risk of bleeding to the patient in the brain or in the joint or anywhere in the body. If you preserve the natural valve, it's always better. They can be on a very milder blood thinner, which poses less risk of bleeding. And yes, as I said, if it is completely damaged valve with both stenosis and regurgitation, it needs replacement. If it is good enough to repair, repair is a better option.
Does having a heart valve disease mean a person could have a heart attack or sudden cardiac arrest, Dr. Asit Khanna?
Yes, if a person has valvular heart disease, the chances of getting a heart attack or any kind of heart disease, heart failure, heart dilatation, arrhythmias, or sudden death are significantly increased as compared to somebody who doesn't have valvular heart disease. If the valves are leaking, the heart generally dilates much faster. If the heart valves are blocked, then the heart becomes thickened and then dilates later. But whatever said and done, there are 4 valves in the heart. Any of these 4 valves or all of the valves or 2 or 3 or any combination of these valves can degenerate over the time, or degenerate or get torn or get infected or get diseased because of deposition of cholesterol or calcium, and they can either become very tough, thickened and restricted in their opening and closing, which is called stenosis, or the deposition or the diseases like very high blood pressure or stresses on the heart can either dilate the valve, resulting in in getting torn, and both of these things can result in a very high incidence of sudden cardiac death and heart failure and heart attacks as such.
Dr. Bhatia, which cardiac tests one should perform regularly? Can regular monitoring through these tests help to prevent heart attack or cardiac arrest?
So there are an array of tests that should be performed regularly. The first, most basic of the tests is not exactly a test, that is a simple blood pressure monitoring. And these days we have even something called as HMBP, that is home monitoring of blood pressure, that should be done routinely to detect the tendency of having a heart disease or a vascular disease. The next basic tests are ECG, chest X-ray. If the ECG is not diagnostic, and like we discussed earlier, if the patient has palpitations, we might go for a prolonged ECG recording, the rhythm monitoring, that is something called as a Holter. Besides that, it is echocardiography, and these days we have excellent tests like nuclear scan that are also added in this armamentarium. For certain diseases like coronary artery disease, coronary angiography might be the first test to go. There are certain specialized tests like specialized echocardiograms like transesophageal echo, dobutamine stress echo. And besides all this, not underestimating the importance of powerful blood tests might help us screen a few diseases like troponin I used to detect acute myocardial infarction, that is a heart attack. NT-proBNP, a test used to detect heart failure. And then a lipid screening, which is extremely important for assessing the individual's tendency to develop a atherosclerotic cardiovascular disease, whether it be myocardial infarction, a heart attack, a brain stroke, or another peripheral arterial disease that might be atherosclerotic in origin.
We'll continue this important discussion, but for now, let's take a quick break. Welcome back. Well, my next question is to Dr. Kumar. What steps should a bystander follow if he or she recognizes that someone is having cardiac arrest? Dr. Anand Kumar D.
This is a very good question and very good situation what a citizen can contribute to the patient's outcome. The moment the bystander recognizes that patient has a cardiac arrest, which a bystander can well appreciate because bystander will be knowing the history of the patient, immediately patient has to be made to lie down on the back of the patient on a hard surface or on a bed depending on the situation. And meanwhile, the bystander should shout for or cry for help so that the other people will come to the place and they will call an ambulance. And the patient has to lock the hands like this and start compressing the mid-chest or over the mid-sternum beneath that heart lies 80 to 100 times a minute, which ensures that the blood is sucked to the left ventricle and pushed into the aortic tree, and the brain is taken care of by oxygenation. The brain is the most sensitive organ in our body, and it cannot tolerate deoxygenation for more than 3 to 5 minutes. So initiation of CPR right at the moment the patient arrests is very, very important. Otherwise the outcome will be dismal. Heart rhythm might come back, but the patient brain will be dead. Patient will be in a vegetative situation. And in developed nations, I have seen that almost every citizen knows on the street how to recognize cardiac arrest and initiate CPR till the ambulance arrives. And in India, I think the government should take it as a big initiative to ensure that in every school and every organization, people are trained to do CPR on a simulator so that they do not get confused what is CPR when the situation arises practically. And it has to be done for at least 30 to 45 minutes or until the ambulance arrives. Or if the patient becomes conscious, that is the time that CPR should be stopped and waited for the ambulance to arrive and shifted to the hospital, which makes outcome of the patient after discharge a lot better on long term.
And why is CPR important during heart emergencies, Dr. Asit Khanna?
Cardiopulmonary resuscitation, CPR, is an extremely important intervention to save lives. In fact, this is one of the cheapest interventions which can save the maximum number of lives. If we compare it with the expensive techniques and devices like an echocardiography or an angiography or a stent or a bypass, the number of people who can be saved by a simple free 5 to 10 minute training of any layman, any school child, any college goer, any person on this planet can be trained in 5 minutes to do a CPR. And the significance or the importance of getting a bystander CPR or done on a person who has just fallen by the wayside on the road or on a station platform or at the airport. And if a bystander can do a cardiopulmonary resuscitation effectively, the number of lives saved every day in the world will be enormous. If a person who's trained in CPR does an effective CPR, the chances of out of hospital survival are markedly increased as compared to those who don't know CPR, and they cannot give it even if they see somebody has fainted or apparently has had a cardiac arrest on the roadside or anywhere outside the hospital premises. So the cardiopulmonary resuscitation, I firmly believe, should be made part of school curriculum, or if not school, then at least college curriculum should include CPR training as an essential element so that we can save much more lives.
Dr. Bhatia, what if the person has an ICD or a pacemaker and they have a cardiac arrest? Can we perform CPR on such patients?
Okay, so that's a great question, and that's a pretty common concern in people. Yes, it is absolutely safe because most of the pacemakers or ICDs, they are placed in the left upper side of the chest below the clavicle. So during CPR, the compressions are given at the retrosternum, that means right at the center of the chest. So ideally it should not affect the pacemaker or ICD, especially if it has been kept for a while. Even if it is done, that pacemaker has been done just recently, the chances that the leads may get dislodged by such vigorous chest compressions, it's a very, very small issue as compared to the benefit that you will provide with a CPR that could save a life. And so the fact that the patient has a pacemaker or ICD should not get in way of your thought that I need to give CPR to a patient. The caregiver should not be afraid, because a lot of people have a fear that the patient has an ICD and if I will give chest compressions, maybe I will get the shock. So even if the ICD delivers a shock internally, it will not affect the caregiver. The next thing is, people believe that the patient already has a ICD, why give CPR? No, because ICD might miss some rhythms. Sometimes some rhythms, some heart beat abnormalities might be at a lower rate that the ICD may not be able to detect, and there might be other reasons of cardiac arrest that are not related to rhythm. In all such cases, the patient actually needs a CPR. So the patient should receive that CPR irrespective of the fact. And the caregiver should not be afraid of the patient that he or she might get the shock. And the next concern is whether the ICD may be damaged by the defibrillator, external defibrillator if we use. So that is also not true. Just that after the CPR or defibrillation, the patient who has received the CPR, their pacemaker or ICD can be checked so that we can ensure that all the settings are still accurate and the patient is having an adequate functioning pacemaker or ICD.
It is well known that exercise can reduce the risk of cardiovascular disease and improve overall health. But what types of exercise are appropriate for patients at this stage of CVD risk? Dr. Anand Kumar D.
The best exercises for heart fitness we advise is walking for 45 minutes or 8 to 10,000 steps, at least say 5 days a week. If the patient is having heart failure, and patient has been asked to take less intake of water, say less than 1 liter, that means patient has reduced heart pumping. Those patients we advise only walking, whatever the speed at which they can walk comfortably for 30 to 45 minutes. If the patient does not have any such instruction and patient's heart is fit or is on echocardiography, the ejection fraction is more than 50%, They can, if their patient is young, they can go for jogging, they can go for swimming, they can do cardiac fitness gym, and even, sound mind in sound body is always better. So I would personally advise people to also adopt meditation, yoga, and some spiritual touch so that the nervous system is also balanced with the body. Fit body and fit mind will give a better outcome.
The availability of portable and home-based electrocardiography (ECG) is an important medical innovation which has the potential to transform medical care. How accurate are the readings though, and is it user-friendly, Dr. Asit Khanna?
Right. Home-based electrocardiography is a step in the right direction. It is part of the disruption occurring in the medical field, that now we are getting more and more devices which are very user-friendly, very cheap, very easy to procure from the market, open market. Patients can just get acquainted with the free app that comes with the device. You can download the app which is provided free by the company which makes the device. You can operate this electrocardiogram device. It is not more than a finger length long. It is you just have to put two thumbs on the device and immediately get an ECG on your phone, which can be very simply transmitted to your doctor in an emergency on his WhatsApp or his email or as a PDF file. This is extremely important. I've been prescribing it, and people have been doing it with a lot of success, especially in those in which the arrhythmias or the problems in the electrical supply of the heart occur very rarely or occasionally. Say patient is fine in the daytime and at night at 2 a.m. he gets an arrhythmia or electrical abnormality, he gets palpitations. Then he has the device at his bedside or in a drawer somewhere, and he takes it out, gets the ECG, sends it to me. But on the other end, a person who doesn't have it, he has to rush to the emergency of some hospital which may be closed, the doctor may be not there, or the machine may not be there at that time. So we are detecting a lot more arrhythmias, electrical abnormalities of the heart because of this, and more patients are getting proper diagnosis and treatment. As far as the reproducibility or the readability of the ECG by these devices is concerned, it's not much of a problem. It's maybe still in the beta phase, but sooner or later we'll get really good ECGs out of these devices. And since they are so cheap, they can be repeated as much as you want till you get the proper ECG.
Well, thank you, doctors, for joining us with some very important information. That's all we have in this show. Thank you for watching.